I did want to talk to you about one of our trending topics,
Okay.
and a trending topic that we're hearing a lot about in our culture, which I'm so thankful that we're having conversations about this, is postpartum depression. So I have a 17-month-old, and a lot of my friends and family members have kids around the same age. And so um, it's something that I'm hearing a lot about. It's a lot of conversations, but I think sometimes it's a little bit still of a mystery because people didn't talk about it for
Mhm.
so long. But now it's
Mhm.
again pretty open to talk
Mhm.
about, which is great. So what would you say postpartum depression is?
Yeah. So postpartum depression is kind of a little bit longer term or duration of feeling depressed after having delivered a child.
Hmm.
Right? And what you said earlier, you're just so happy that we're finally kind of talking about this. Yeah, for many years, maybe throughout all of history, there's such a stigma
Yeah.
around this. And really because of cultural beliefs that, oh, you have a baby, it's great, it's this joyous, wonderful occasion, which it is.
Hmm.
But for many folks, it's also one of the most challenging transitions that they'll have in their life. Not
Hmm.
only has your body physically changed, right? And you're moving from pregnancy into postpartum. And
Hmm.
so there are a host of hormonal changes and structural changes, sleep disturbance because you have a newborn. And so all of these things kind of contributing to a potentially really difficult time and season
Hmm.
for parents. And postpartum depression is not just for moms, but there's also some research talking about paternal postpartum depression for dads, for the fathers that can also experience kind of this shift as they move into this new stage of life. And so really this prolonged season of being kind of in a depressed or kind of a mood swing sort of state is right at a high level what postpartum depression is. Not to be confused with just kind of the baby blues that maybe we hear about as well, where you might have some of that mood swing or the anxiety, feeling overwhelmed, which is all very normal, but it's some of this where it feels even more pronounced.
Hmm.
Heightened sense of brain fog or irritability, maybe even anger or a feeling of hopelessness, or just a compelling or pervasive feeling that you're really not good enough, you're worthless, you're a terrible mom or dad, that all of these kind of things that last for more than a couple of weeks,
Hmm.
where we might enter into any one of those areas just as a parent, feeling that for a short amount of time. But when we feel it for a longer period of time, a few weeks, or maybe it's lasting months before you really become aware of, wow, I've been feeling this way for a while.
Hmm.
Yeah.
So then with that, like you said, it's like more prolonged. It's
Mm-hmm.
happening for like weeks on end. What
Mm-hmm.
are additional warning signs of postpartum depression?
Yeah, so that sense of just feeling so overwhelmed that you really can't do some of the normal daily activities. Maybe you're feeling like I'm really worthless, or this is hopeless. I'm not
Mm.
a good mom. I'm not a good wife. I'm not a good parent. Maybe you're starting to pull away from friends or family or other support system. You're not really engaging in a lot of the activities that maybe you would otherwise do, even given the nature of being a parent of a newborn.
Hmm.
Maybe you're really having some other physical symptoms, loss of appetite or overeating. You might have really lost a lot of weight or have gained a lot of weight, either case. And so looking at like some of the other physical signs too, maybe insomnia, or I just want to really sleep all the time and I don't feel like I can just really function, and just the general feeling that I am not myself.
Mm. Mm. So I guess like with all of that in mind, what would you give, like advice wise, what would you give to a woman who thinks she's experiencing postpartum depression?
Yeah, so I would say don't ignore it.
Mm.
Don't ignore it. Don't think it's just going to go away. Don't think that you shouldn't be this way.
Mm.
Because if you are this way, there is a lot of help for you. So even just talking with a counselor, a good friend, some other supportive people in your life can be really helpful to help you feel that support and that care from someone else. A lot of just talk therapy can be very helpful to kind of unpack and really express what you are experiencing in this season of life.
Mm.
And there may be some medication support that could come online as well. While I'm not a medical doctor, sometimes this will be treated with antidepressants, anti-anxiety medications that can really help support you through this season to get back to who you are, who you want to be. And so there's lots of different avenues. I really want to stress, if you are experiencing any kind of thoughts of harming yourself or your child or anyone else, that you seek immediate attention. Call 911, take yourself to the emergency room, get help immediately, and even call our National Suicide Prevention Lifeline. And that number, I'm going to give it to you now, is 800-273-8255. But please do not ignore that. Don't think it's just going to go away, because it likely won't. But with the proper help and support, you can move back into who you are and who you want to be.
Thank you for that. Thank you for that. So if I could ask just one more question on this topic of postpartum depression, what advice would you give to a husband who thinks that his wife may be experiencing postpartum depression?
To gently and carefully and with as much kindness as he can bring up, to talk with her, to let her know how important she is, and that he sees maybe the struggle that she's going through, and to encourage and to support her in seeking help to find some answers and to find some resolution, because it is very solvable. None of us have to struggle through that alone. And there is so much support and help for this, that the support of a husband to a wife who is experiencing this can be very profound. And to just feel like he notices me, he sees that I'm struggling, and he wants me to find the help that I need, can be very impactful to her.